Hi all, welcome back to Microbiology Lectures. Today we're going to talk about how we go about controlling or attempting to control microbial growth. Okay, the last few lectures we were talking about how microbes grow, with a lag phase, an exponential phase, a stationary phase, death phase, and then a prolonged death phase. And what can control that kind of exponential phase, which is what we're kind of most interested in, is what's happening in that exponential phase, and maybe even in the stationary phase. So now we're going to kind of talk about, well, how do we control microbial growth? And so let's jump into it. Of course, we know a lot more about hand washing and antibiotics now in today's society, but let's jump back to kind of a glimpse of history, and we'll talk about one individual, Agnes Semmelweis, who was a Hungarian gynecologist. And Agnes was he was at the forefront, I guess you could say, of determining why people were getting sick and dying during childbirth, and why their children were being infected and dying in the facility that he was working in. And let's just put it this way. And during this period of time in the mid 1800s, it was really common for doctors to work and do autopsies and determine what caused the death of an individual, or just learn more about human bodies by dissecting or cutting open cadavers and exploring cadavers. And so it was really common in a lot of the facilities that you would have doctors that were working on cadavers, and then the doctors would move from working on cadavers to working on live people. And Semmelweis realized that there was a discrepancy between physicians, and the physicians are the doctors that were working on and had patients, and the amount of people that were dying during childbirth or before childbirth, or being infected with this disease, this birthing fever. There was more that were getting this birthing fever when the person that was seeing them was a doctor, than if you looked at another kind of facility where the mothers had a midwife. And so it was actually significantly higher, the cases of producing this fever during pregnancy or the birthing process, or right after, that was lethal in many cases. It was significantly higher when you're being seen by an actual doctor than if you were being seen by a midwife. And Agnes his goal was to figure out why. And what had happened is he had a friend that actually nicked his finger during a autopsy and died from what they expect is from that exposure of his this wound during this autopsy. And Agnes looked at he did the autopsy on his friend that actually had passed away, and he found these pustules, these little what we now know is bacterial infection. But at the time, he found similarities between his friend, the corpses, the autopsies that they were doing, and women that were dying during the birthing process. He found that the same bugs, these same pustules, these same things were found in all three entities. And so what Agnes had said to his fellow doctors is, hey, we're the cause. We're causing these birthing fevers because we are dragging microbes from the morgue, from our autopsies, to these women that are pregnant. And so he got people to think about washing hands, and not just washing hands, like rinsing their hands off before, from the morgue to surgery, but actually washing their hands with a antiseptic and their tools. That was another thing. They'd carry their tools from the morgue to live people, and so he kind of encouraged them all. And at the time, you have to realize, Samuel he wasn't like one of the lead doctors. He was fairly new, and a lot of people they didn't accept this. They didn't accept his research. They didn't accept his idea that these physicians were the ones that were causing this, and he was ridiculed, constantly ridiculed. And there's some thought that that's kind of what made him start to lose his mind or go a little bit crazy. But the story goes that eventually a lot of the doctors at the facility got Agnes they tricked him into going to an insane asylum. And when he got there, he found out what the facility was, and he tried to leave, and the guards captured him and beat him up and stuck him in the insane asylum, and he died there. So anyways, kind of a brutal, gruesome story of, the guy that really, he's known as the father of hand washing. He really started the idea that you should be washing your hands after procedures, before procedures, to prevent the movement of, but we didn't know what they were at the time, but movement of bacteria in this case, we know now. Okay, so it kind of gives way to another physician, Joseph Lister, who, along with Samois material and Louis Pasteur's material, he realized that a lot of what was going on is, surgeries and things like amputations and all kinds of things were done in open rooms with not good airflow, or maybe too much airflow, and no one was wearing gloves, and people would wash their hands maybe, but their tools might not be that clean. And so he thought that a lot of the reason why people were dying from simple procedures even were the result of, these microbes, things that you couldn't see, based on Pasteur's work, minute organisms that you couldn't see. That's what was causing the infection. So Lister decided, hey, let's spray during our surgeries and during our operations, let's spray something that, could kill these minute organisms. And carbolic acid, or phenol, was used. And so they would take and they would spray this while, before and during surgical procedures, and it helped reduce a lot of the infections. And so then they just kept going, and they started to clean their tools and spray different things that we'll talk about, the role that pH or temperature plays in preventing microbial growth. But that acid, that was really important, because a lot of the microbes couldn't grow in it, so it prevented the infection. And so between Agnes and Lister and Pasteur's work, we really started to utilize sterilization and antiseptic procedures to prevent infections, or at least decrease the number of infections that we're seeing in hospitals and really all over the world. And later on, Lister is where we get the name Listerine, and that was due to combination of him inventing different sterilization methods, and then this oral antiseptic that he was named for him and his work in 1879, and has been used ever since. So that's kind of just a glimpse of the history of antiseptics and trying to prevent infection. So the goal, often when we're talking about control, the ideal goal of control is sterilization. Okay? The goal is to sterilize the equipment, sterilize the facility, sterilize whatever it is, to destroy all microorganisms and viruses. So in this case, we call them microbes, all of them. So sterile items must be microbe free, no microbes, including the endospores. And when sterilization first came about, we actually we hadn't discovered pyrons, but we sometimes don't consider pyrons. But I'll tell you this, if people if they had their way, sterilization would include pyrons. It would include any pathogenic material. And one of the best ways that we know to sterilize equipment that can actually be sterilized is to use an autoclave. And autoclaves will use temperature and pressure to destroy pathogenic organisms. Well, really, for that matter, to destroy pretty much all organisms, whether they're living, whether they're viruses. Some pyrons can live through autoclave and whatnot, but for the most part, the destruction of all microorganisms and viruses, autoclaves. And we'll come back, we'll talk more about autoclaving quite a bit. Okay. Another method that we often use to control is disinfection. Okay? And disinfection works great to eliminate the majority of the pathogens. That's the idea. Now, we're happy if we could eliminate them all, and there are some chemical disinfectants that are considered sterilants, and so they can actually be considered a sterilization method. But for the most part, most disinfectants, which are often chemical based, are just going to remove the majority of pathogens. And there are some microbes that may remain. There are some endospores that might be resistant to the disinfectant. But overall, that's kind of the arching goal of disinfectant, is to eliminate the majority of all pathogens. How we classify these, okay, it really depends on what they do. You can have a cocktail where your disinfectant cocktail might include a bactericide, a fungicide, a viricide, and you might be utilizing that. Sometimes the disinfectant, maybe it's just a bactericide, but at any rate, we often just label them germicides, and the purpose is some cocktail of chemicals. It's normally a cocktail, some mix of chemicals that destroy lots of pathogens, preferably all of them. Okay? The antiseptic is, I guess, kind of along the same lines as a disinfectant. The antiseptic, though, is for living tissue. Okay? We're trying to get rid of all pathogenic material but this being on living tissue. And so for things like surgery and whatnot, and we'll come back and we'll talk more about that piece. Okay, but just realize that normally we're talking about sterilization for tools that can be sterilized. Disinfectant, often we're talking from, like if we're talking a medical facility, we're talking about disinfectant for large objects, maybe tabletops and potentially floors and counters and whatnot. And then antiseptic for the individual. If we're talking about a surgical area, the individual would have the antiseptic. Okay. Decontamination. So it depends on what the facility is, what the action is, but decontamination is normally, we're talking about reducing number of pathogens to safe levels. This could be drinking water, this could be food, this could be a doctor's office. Like, you're trying to reduce the number of pathogens to a safe level. And that can be washing things, using heat, using chemicals, using irradiation, different methods. Sanitation, that's decreasing microbes to a manageable population that meets some kind of health standard. Okay, so these two can be directly linked together if we're talking about like foodborne illnesses and things like that. Then you would decontaminate to a sanitation level, and so there's lots of ways to do that. Lots of different methods. Okay? We'll talk about preservation or preserving items. Okay, normally we're talking about this from a delay spoilage or delay the breakdown of an item. It doesn't have to be food, but normally when we're talking about preserving through, like, from a bacterial perspective or a micro perspective, we're talking about delaying spoilage. But it could be delaying breakdown of a material, maybe one that we're not even going to consume. But often they'll have some kind of bacteriostatic or something that prevents the item from growing. Sometimes this is things like salt, sugar, that prevent the organism from growing. Other times it's some other chemical base that might be spread on the material that prevents its preservative. And then pasteurizing is kind of a way of preserving, or at least a way of decreasing microbes for a given amount of time. Okay, pasteurization, we talked about Louis Pasteur many times. That's what it's named for, his method of reducing the number of spoilage organisms. Normally when we think of pasteurization, we're thinking of milk products, but there are other ways in which pasteurization can occur, like cold pasteurization where there's no heat, mainly because the organism or the entity that you're going to pasteurize, you can't heat it. So like cold pasteurization, we often talk of, and we'll talk more about this, but it's like things like maybe like juices and things like that, where if you heat them, you'll break the sugars up, or you'll change the flavor of the material. So you have to use some other method like cold pasteurization. When Louis Pasteur came up with this, he was bench topping it, which is pretty amazing that he came up with the process of pasteurization by heating unpasteurized milk to a certain temperature, and then super cooling it as fast as he could, not changing the flavor profile, but also inhibiting the growth of the microbes that would spoil that. And so it's down to an exact science now, but when he was doing it, I mean, he was doing it in beakers on a benchtop, which is kind of cool to think that he controlled the temperature enough to denature the enzymes that the pathogens had, but not to denature the proteins or damage the sugars inside that milk product to change the flavor. And so, kind of cool stuff. Alright, so when we, one more thing that I want to talk about, another method that's kind of, I don't want to say it's super new, but it's new-ish, is for products that, you don't do well with heating, so you can't heat a strawberry, don't do very well with pressure, or whatnot. There's another method which we call irradiation. So you blast them with different photons, whether that be gamma, UV, something, and that destroys the microbes, but doesn't harm the food product itself. And we'll come back and we'll talk about this. There's different takes on whether this is a good thing or a bad thing because of the way in which it destroys the microbe, but at any rate, for the most part, it's considered safe. When we come back, we'll talk about biosafety levels, and then we'll kind of go into some of these subjects in greater detail next time.